Today, we're diving into a drug that is, no exaggeration, a frontline lifesaver, and also one of medicine's most delicate balancing acts. We're talking about unfractionated heparin, and as you're about to see, it is a true double-edged sword. So let's frame it with a question. What if I told you there's a drug that can stop a deadly clot dead in its tracks, but using it is like walking a tightrope? That substance is heparin, and its story is all about that incredible, high-stakes balance. All right, to really get this, we first need to understand the villain of our story, the dangerous blood clot. The official name is thrombosis. And really, it's just what it sounds like, a traffic jam, a roadblock right inside your circulatory system. It's a blood clot forming where it absolutely shouldn't be, and this one single problem is the root cause of so many medical emergencies. And the consequences of that roadblock? They're devastating. If that clot blocks blood flow to your heart, you get a heart attack. If it's in the brain, it's a stroke. And if that clot breaks loose and travels to the lungs, well, that's a pulmonary embolism, and it is incredibly life-threatening. The stakes just couldn't be higher. So now that we know the threat, let's meet the hero of our story, the powerful weapon designed to fight it. Let's talk heparin. We're focusing today on unfractionated heparin, or UFH for short. It's pretty amazing, actually. It was discovered over 100 years ago in liver cells, which is where the name heparin comes from, the Greek word for liver. It's a powerful anticoagulant, which is really just a fancy way of saying it stops your blood from clotting by throwing a wrench into a process called the clotting cascade. And this is such a great way to picture it. Imagine your body's clotting system is this long, perfectly arranged line of dominoes. When you get a cut, the first domino falls, and it sets off a chain reaction to form a clot. What heparin does is act like a hand that just swoops in and pulls a critical domino right out of the middle. The whole chain reaction just stops, cold, and the clot can't form. It's that direct. Now, it's really important to know there are two main types here. You can think of UFH as the original, raw power tool, like a big, heavy sledgehammer. It's incredibly effective, but you have to handle it with extreme care and watch it constantly. The other kind, low molecular weight heparin, is more like a modern, specialized hammer. It's refined, more predictable, and often easier to use. But when you're in an emergency and you need pure, fast-acting, and reversible power, that classic UFH sledgehammer is still the go-to tool. And here's why. It all comes down to speed. When you push UFH through an IV, its effect is immediate. The second it hits the bloodstream, it's working. But look at the duration. It's pretty short, just 4 to 8 hours. And that's actually a huge advantage in emergencies because it means its powerful effects can be managed and even stopped in a very controlled way. Okay, so we've got this powerful, super fast tool. Where exactly do doctors deploy it? Let's look at its key missions. This really shows you its mission profile. It's used right in the thick of a heart attack, what doctors call acute coronary syndromes. It's used to bust up dangerous clots that have already formed, like a deep vein thrombosis, or DVT, usually in someone's leg. And it's even used proactively to prevent clots from ever forming in the first place, especially for patients before or after a major surgery. But remember what we said at the start. This is a double-edged sword. And all of that amazing power to stop clotting comes with a very, very serious flip side. You see, the very thing that makes heparin a lifesaver, its ability to stop clotting, is exactly what makes it so dangerous. If you stop that clotting process too much, you can cause uncontrolled spontaneous bleeding. This is absolutely not a drug to be used lightly. So the most important thing for any doctor is knowing when not to use it. These are the absolute hard stops, the contraindications. If a patient is already bleeding or just had delicate surgery on their brain or eyes, giving them heparin could be catastrophic. These are total, non-negotiable, no-go zones. And even when it is the right call, you're not out of the woods. There are serious risks to watch for like a hawk. Hemorrhage, that's major bleeding, is number one, of course. But it can also cause a sudden drop in platelets, the very cells that help you clot, or even trigger allergic reactions. Constant vigilance is everything. And just to make things even trickier, some of the most common over-the-counter drugs out there, things like aspirin and ibuprofen, can dramatically ramp up the bleeding risk when they're in the mix with heparin. This is why getting a full, honest patient history is so critical. Okay, so all of this brings us to the true mastery required to use this tool. It's not just about giving the drug, it's about the incredible art and science of dosing it perfectly.
I mean, just look at how precise this is. This is not a one-size-fits-all situation, not even close. The dose is meticulously calculated based on a patient's exact weight and the specific reason they're getting it. A heart attack gets a completely different dose than a clot in the leg. This requires absolute precision and sticking to the protocol.
And this is what it's all about. This is the ultimate goal, hitting something called the therapeutic window. It's that perfect sweet spot where the blood is just thin enough to stop dangerous clots from forming, but not so thin that you start to bleed spontaneously. It's a constant, delicate balancing act. So how do they know? How do they know if they're in that window? They measure. This number right here represents the target range for a specific lab test. Doctors are trying to make a patient's blood take about 1.5 to 2 times longer to clot than normal. It's a specific, quantifiable target they are constantly chasing with tiny adjustments to the dose. So, let's bring it all together. Using heparin isn't just administering a drug. It's performing one of modern medicine's most difficult and most critical balancing acts. And that balance becomes even more delicate in special cases. Take pregnancy, for instance. Most of the time, the safer, more predictable LMWH is preferred. But UFH might be used right around delivery because its effects can be turned off so much faster. It just highlights that constant, non-negotiable need for monitoring, for lab tests, and for sticking to those strict protocols. So the bottom line is this. Unfractionated heparin is the definition of a high-stakes medication. It saves lives every single day, no question. But it demands unwavering vigilance, mathematical precision, and an enormous amount of expertise from the people who use it. And that really leaves us with a final thought to chew on. Using heparin is a constant tightrope walk between saving a life and causing serious harm. It really makes you wonder, how many other powerful tools in a doctor's toolkit, from chemotherapy to radiation, exist on that very same razor's edge, demanding that same perfect, life-saving balance?